Secondary AML is a distinct type of AML, with usually with poorer prognosis than the novo AML, because patients are elderly, because we have more adverse risk cytogenetics, patients tolerate less chemotherapy, and they are more resistant. So usually the overall survival is like 7 months, and the CR rate is only 40 to 50%. And previously in the acute leukemia working party, we compared transplant from sibling and or unrelated in secondary AML versus the novo AML, and showed that the results with secondary AML were inferior. Subsequently, we look on haploidentical transplant in secondary AML, because non-T-depleted haploidentical transplant with PTCy reduced transplant-related mortality and incidence of GvHD, and may be associated with a stronger graft-versus-leukemia effect. And we show indeed that with haploidentical transplant in the secondary AML, results are similar to the novo AML in patients that are in first complete remission, and the haplo can rescue about 60% of the patient. And also in patients with relapse or refractory disease, when we compared haplo in secondary AML versus the novo AML, we can rescue 30% of the patient, and the results were similar. But it's not known if bone marrow or peripheral blood are the best graft source, because in peripheral blood maybe you have a stronger GVL effect. So we compared the bone marrow and peripheral blood for patients with haploidentical transplant with PTCy and secondary AML, and did not show better outcome with the peripheral blood. So we failed to show a stronger graft-versus-leukemia effect with peripheral blood in haplo with secondary AML compared to the bone marrow grafts.